The optical segment of the visual pathway focuses light from viewed objects by refraction, the deviation of light rays as they pass through curved transparent surfaces of different refractive index. 2/3 of the eye's refraction occurs at the front surface of the cornea. The rest occurs at the front surface of the native lens. In the ideal condition, the eye's refracting power is matched to its axial length, so that parallel light rays coming from 20 feet or beyond are focused onto the fovea. This condition is called emmetropia. Unfortunately, most eyes are not built to provide emmetropia. For example, they might focus distant light rays in front of the fovea, a condition called myopia or nearsightedness. To bring these light rays into focus, a spherical concave lens must be placed in front of the cornea as a spectacle or contact lens. If you are not content wearing glasses or contact lenses to correct your myopia, you could engage a surgeon to weaken the focusing power of the cornea by a variety of procedures called refractive surgery. In this procedure, called laser-assisted in situ keratomileusis, or LASIK, the surgeon uses a femtosecond laser to cut a superficial corneal flap. After the flap is folded back, the laser sculpts the corneal tissue bed to alter its curvature. Then the flap is carefully repositioned and the operation is done. The eye's optical apparatus might instead focus distant light rays behind the fovea, which is called hyperopia or farsightedness. To bring these rays into focus, a spherical convex lens must be placed in front of the cornea. Once again, you could choose refractive surgery in place of glasses or contact lenses. In some cases, the eye is neither myopic nor hyperopic. Instead, the cornea lacks a spherical surface, so it focuses distant light rays along a plane rather than at a point. This condition is called astigmatism. To bring light rays to a point focus on the fovea, a cylindrical lens must be placed in front of the cornea, often together with the appropriate spherical correction. If you are not satisfied with wearing glasses or contact lenses, you could undergo refractive surgery to make the corneal surface rounder. When the eyes view an object at reading distance or computer screen distance, light rays coming from that object diverge as they strike the eyes. In order to focus these rays onto the fovea, the eyes must increase their focusing power. That happens automatically as the brain senses that the viewed object is out of focus and triggers contraction of the ciliary muscle and loosening of the zonules that suspend the native lens. Freed from the restraints of tight zonules, the lens assumes a more rounded shape and increases its focusing power. The diverging light rays are now focused on the retina in a process called accommodation. Accommodation works well in youthful eyes, but with advancing age, the native lens loses its flexibility. As the ciliary muscle contracts and loosens the zonules, the lens no longer becomes round enough to focus light rays on the retina. This aging failure of accommodation is called presbyopia. Fortunately, help is in sight. A convex focusing lens can be prescribed for the bottom part of a spectacle as a bifocal, trifocal, or multifocal. This lens increases the eye's focusing power for objects viewed at reading or computer distance. Uncorrected refractive errors and accommodative failure are not the only reasons for indistinct vision. The normally transparent ocular media, the cornea, the lens, and the vitreous, may have become opaque through disease. An example would be cataract, which is an opacified lens. It interferes with clear transmission of light to the retina and causes blurred vision. As a result, optical correction will not provide distinct vision. Surgery will be necessary to remove the lens and replace it with a transparent lens implant. Watch how the surgeon does this. After making an incision on the edge of the cornea, the surgeon slices open the anterior capsule of the native lens. Now she inserts an instrument that breaks up the substance of the cataract with ultrasonic pulses and aspirates up the pieces. The posterior part of the lens capsule is left intact. Now a folded implant is inserted into the empty capsular bag. Within hours, the patient will appreciate clear, distinct vision.